Hello, my name is Jacqueline Schrot, and I'm the CF Nurse Coordinator at Children's Hospital of Michigan. I've been lucky enough to be in my position for about the last 15 months, and it's amazing how much I've learned and the people I've met in that time period. I first of all wanted to speak a little bit about Children's Center. It was actually one of the first 10 centers established in the United States in 1962. We currently have about 130 patients, and we are also affiliated with the Harper University Hospital Adult CF Center, which has about 100 patients. I wanted to talk to you tonight basically about the role of the CF Nurse Coordinator and how I can help you to make your patients and your family members' lives a little more easy. As we've talked about, there's a lot of changes in medications and insurance that are constantly changing, and we're really the first contact once you have a concern or an issue. The first role that I have chosen to speak about is being the liaison. I am constantly on the phone or in clinic speaking with families about their concerns, and I am the one who usually brings those concerns to other team members who can then assist in addressing those concerns. Also, when someone is inpatient, we go and talk to the team members, inpatient and outpatient, to discuss concerns that are there, make sure that infection control guidelines are being followed, meeting with staff to teach about CF and the different medications and therapies that are being involved. Also, there's the education part. We provide the educational materials, provide demonstrations on new medications, meet with the doctors and families about new diagnoses. We have 2 events every year, a family gathering and a family education night, to provide updates for caregivers and family members, bringing in different speakers for the caregivers, and we provide a newsletter. As my role as a first contact, we feel that it is important that the families feel comfortable that the nurse that they're speaking to on the phone is also the nurse that they speak to in clinic. And so when you're speaking to somebody in clinic, you're not giving your story the first time. They understand what medications you're on, whether or not you may have insurance concerns or medication concerns. And also we can get the proper people involved, whether it's outside organizations, the foundation, insurance companies, to make sure that the needs are being met. And then following up with those people to make sure that everything's been settled. We also involved with advocacy, insurance, FMLA, Social Security, making sure that that paperwork is being sent to the necessary people. And one of the last things I guess I would speak about is the research. As they've talked about, Kaleidoco's been very involved. We're involved with the Toby Podhaler, and other studies. As the CF Nurse Coordinator, we're involved with making sure that families are aware of the research opportunities that are out there and helping to screen patients for certain studies. And another thing that in my position that I'm involved in is updating policies and procedures on the infection control, making sure that the proper equipment and such as gowns, gloves, and masks are available inside the clinic setting, which I know families are very involved with, also making sure that everything's being followed closely, and educating the staff on these new policies and re-education. And we also involved with fundraising such as the CF Walk, and we have our own foundation that there's information in the packet that I spoke about and provided on each table. Does anyone have any questions? I think I spoke quite fast.